Every year, around 700 women die from childbirth. A CDC study found that out of these 700 women, 108 are white, 250 are indigenous, and 342 are black. Despite its claims of racial equality, the United States fails to provide equitable access and outcomes for its citizens. In 2021, it is necessary for the Biden administration to address the racial disparities in our healthcare system and ensure the provision of an equitable chance at bringing new lives into the world. Women of color experience racism in OBGYN care as a result of several factors. These include biases at the provider level, mistrust of the healthcare system, and socioeconomic inequities. The OBGYN field has long been rooted in racism. Many medical discoveries are owed to enslaved women in the 19th century. The father of modern gynecology, James Marion Sims, used inhumane practices of experimentation on these women's bodies.
And so a lot of actually modern gynecology is owed to the bodies of Black women who were these, unwilling subjects, and helped our field to understand more about what was going on, but it was done in a very unethical way.
In addition to historical wrongdoings, communities of color suffered as the subjects of eugenics practices and were often unwillingly sterilized. This perpetual mistreatment resulted in a deep mistrust of the medical system.
Why are they going to trust doctors? Why are they going to listen to what doctors have to say? Because they don't listen to their patients. They don't take their symptoms into account. They just blow off their symptoms.
A large factor in the United States' disproportionate maternal mortality rate is the failure of white doctors to acknowledge the existence of bias and its effects on patient care.
Something that we see a lot in women's health, where, maybe someone's symptoms are ignored, particularly pain. So, it's been shown that, there's a train of thought that Black people have a higher threshold for pain. And part of that is rooted in the inferiority or an idea of differences that comes from slavery.
World-renowned tennis champion Serena Williams gave birth to her daughter in 2018 and publicly shared her difficult delivery experience.
Really, race is a surrogate for racism. And then postpartum listening. Think about Serena Williams' story. This is a woman who had had a pulmonary embolus before, was having the same symptoms. She's got more money than God, and the nurse was blowing her off.
Had Williams not been so persistent in seeking care, she may have experienced the same fatal outcome as other patients of color whose doctors refused to listen. A majority of America's doctors harbor implicit bias against patients of color, leading to harmful misconceptions and a disconnect between doctors and their patients.
I think it's really important that providers listen to all their patients, but especially when we know that Black women are more at risk of maternal mortality, that we listen to Black women, and that it's better to have the err on the side of caution, especially as it relates to trying to make sure that we have positive outcomes for moms and babies.
Socioeconomic disparities act as a significant block in access to care and equitable outcomes.
Of course, there are basic things like access to transportation, safe ways of getting to appointment, and then there's the quality of care, things like C-section rates. That's another health disparity in the maternal health space, increased risk of hemorrhage, increased risk of death, increased risk of blood clots. All those things are greater in both low SES women and Black women.
The maternal health crisis presents challenges at many levels. Steps for reform include acknowledging the presence of racism within the medical field, implementing mandatory bias training throughout medical education, and extending postpartum care coverage to a year.
Today, many low-income women lose their Medicaid coverage at 60 days postpartum, considering that 1 in 8 maternal deaths occur between 42 and 365 days postpartum. Extending Medicaid coverage to up to 1 year postpartum could be an important first step toward reducing late maternal deaths.
I think what we need is such trainings, instead of just being one-offs or two-offs where, maybe doctors in training in their third year have a couple of good anti-bias trainings. It needs to be embedded throughout medical school and longitudinal.
From the one side, there's a difference there in cultural experience of racism that I have to acknowledge with my patients and myself. So I have to acknowledge that and be willing to name it and own it and appreciate that I've been the recipient of a tremendous amount of privilege throughout my education and my background.
Additionally, Congress must pass legislation such as the Momnibus Act, which would implement progressive steps to reduce outcome disparity. The Biden administration and Congress must take action to uphold our country's promise for just treatment and an equitable healthcare system.
I think a lot of times when people hear racial, ethnic disparities, they think it has nothing to do with them. But you have to understand that when we are all well taken care of, we will all be okay.